Good morning. Welcome to MindPat Care's live session entitled Helping College Students Cope with Anxiety and Depression During this COVID-19 Pandemic. Before we get started, I'd just like to let you guys know a brief introduction to who I am and kind of the purpose for us doing this. So, my name's Carrie Mackey. I'm a psychiatric PA that believes in the transformative power of peace of mind. I also do inpatient medicine part time. In my work, I've seen how mental health stability can ease other health issues as well as life stressors. I try focus on building trust and being a comforting presence for my patients. I collaborate with them to help them realize desirable, attainable goals that can easily be maintained through a combination of psychotropic medications as well as holistic care plans. I envision myself not only as a healthcare professional, but also as an advocate for other PAs and other healthcare professionals. I'm proud to boast my Bahamian roots, as cultural heritage I feel influences some of my core values and beliefs. I currently offer medication management for a wide variety of mind pat care needs. Let's see. Think we're having some connectivity issues. Give me just a second. Okay, I think we're back on board. So, as I was saying, I see patients for ADHD, adjustment concerns, anxiety, bipolar depression, OCD, postpartum depression, psychosis, PTSD, traumas, and some adjustment disorders. In our description, you can find a link for how you can access MindPat Care's telehealth services, and this would be for residents of North Carolina. So, briefly, I'll talk about some of the issues that many are facing currently. These are college students, and I want to touch briefly on high school students as well. Some of these psychological stressors that people are having, I want to elaborate on how we can find ways to cope and adjust different strategies that we can use to help us get through these perilous times. Um, as I said before, this live session is for college students, but let's talk a little bit about high school students. For many, now is the time where you begin to think about to transition to college. You start to make your way on campuses and do tours. You're also realizing that the reality is you can't do this as you once would have done before. It's are trying to do virtual tours for campuses for incoming freshmen. Many of the college campuses and admission officers that I've spoke to are also trying to do webinars and Q&As so that you can get all of the information instead of just trying to make a decision off the dome. For those already in college, some of the things that may be challenging you is to transition from being in classes on campus to having to divert quickly back home to your parents' home or having to find other living accommodations, which can be stressful in the spur of the moment. This presents a real challenge, and it can significantly raise one's anxiety, which we'll talk about more later, exactly what anxiety is. This can also spur a depression for others, as this is a major life changer or a major stressor. Many colleges and universities have moved at rapid speeds to transform a classroom based curriculum to an online based or virtual learning, which again is another immaculate challenge. Some of the questions that remain unanswered are whether or not room and board will be reimbursed for students that were on campus. Some students wonder about will tuition be readjusted? Will the price go down because they aren't in class utilizing those services anymore? Some students wonder about whether a course pass or fail instead of the traditional A to F scale should be implemented as to better their chances of not failing out of a class because of the change. It's difficult. The one big concern that I've heard from a lot of my college graduates or college students currently is, will graduation be scheduled for a later date, or will it be done virtually? These are all questions that need answers, all questions that can cause ruminations and questions that can cause constant worry and concern about, about our future. A lot of My students have began to talk to me about wondering if their applications into the medical program or professional school will be disadvantageous because of this lapse or because of falls in grades because of the transition to the online system. Another item that many are worrying about is what the job market will look like once the pandemic begins to resolve itself and the economy stabilizes. Many individuals were furloughed, terminated, and will be seeking employment. Now, college graduates are comparing the competition between experience and them being a newly commissioned profession. Once again, things to worry about, things to think about, things to raise one's anxiety. For my recent college graduates and those still in school, I know many universities are offering free or sharply discounted certificate courses to add to your skill set and repertoire. You should focus now on resume building, planning and organizing your next steps. If you aren't at that point in college but seeking for what the next steps are for the next semester, maybe you can get a jump start in planning for activities and events for your social organizations and clubs, whether this be Greek sororities and fraternities, SGA activities, or international organizations that you may or may not belong to. Depression and anxiety are very common diagnoses in the world of mental health. Many of us are affected by one or both issues at some point in our life. Stressors like the things that I previously talked about and highlighted may appear in a brief episode or a brief stint, may be transient or may be chronic or long term, so to speak. Normally, a major life changing event would trigger or be the cause of a depression or anxiety. The life changing events revolving around depression and anxiety are typically things like breakups or a bad relationship, loss of a family member, or change in an environment. Some of the things that people struggle with while they face depression and anxiety that can make it worse is perfectionism, low self esteem, test anxiety or exam performance, and financial woes. The way we deal with this is trying to maintain a schedule, whether this is eating on time and having appropriate meals, not lying around at home and not doing anything, or being buried in the couch. But increasing our productivity has proven to be effective in helping to negate and abate some of the symptoms and signs of depression and anxiety. Social media is a great platform, and the internet is one of our best resources. Depending on what we use it for, more positive thoughts and actions lead to more positive negative thoughts and actions can drive ruminations or continuous negative thoughts about ourselves and our situation. Being able to identify stressors and when we don't feel like ourselves is very important. Even more important is being able to seek out mental health care, to find a practitioner to aid and assist us with coping with our issues and battles of depression and anxiety. We must be careful not to self label and diagnose, as perception can play a negative role in the way we view ourselves and our clinical outcomes. Anxiety and depression, if approached the correct way, are both able to be treated and put into remission with a wide arsenal of tools, including therapies, medications, and a combination of the two, as well as mindful practices. So, what's depression? Depression is a common and serious medical illness that can negatively impact the way you feel about yourself. Depression causes feelings of sadness, loss of interest in activities once enjoyed. It can lead to emotional and physical problems, and it can decrease one person's ability to function and work at home or in the school setting. Depression symptoms often can look like feelings of sadness or depressed mood. You can have a loss of interest or pleasure in activities that you once enjoyed, changes in appetite, weight loss or gain unrelated to dieting, trouble sleeping or increased fatigue, increase in purposefulness activity, slowed movements and speech, feelings of worthlessness or guilt, difficulty thinking, concentrating, or making decisions, thoughts of death or suicide. These are all really, really serious things. Depression takes 2 weeks to make a diagnosis of. So these symptoms that I just talked about must persist continuously for a 2 week period for majority of the days in order to diagnose oneself with depression. If you see these things, in excess of the norm, it would definitely be advised to seek mental help. Depression is multifaceted, and I like to have this talk with my patients about the things that kind of lead and play into depression. One of them is the biochemistry. So, the difference in certain chemicals in the brain may contribute to symptoms of depression, whether this is serotonin levels, dopamine levels. These things are biochemical related and actually control the way that we feel. Another thing is the genetics. This is something that we really can't run from, but depression runs in families. For example, if somebody has a twin or a mom, a dad that has depression, the other has a 70% chance of having the illness sometime in life. Personality. People that are innately low self esteem, people that are typically overwhelmed by stress, and people that are pessimistic or negative mindset and views about life tend to be more predisposed to depression. And then our environmental factors. So the continuous exposure to virus, on the other hand, is seen as a serious medical condition, just as serious as a heart attack or diabetes, because there's a physical response to it. There are different forms of anxiety, but a diagnosis of anxiety must be made over a 6 month period of time. Some of the signs and symptoms of anxiety are feelings of nervousness, irritability, being on edge, having a sense of impending danger, panic, or doom, having an increased heart rate or palpitations because you can actually feel anxiety onset in many people, feeling weak or tired, difficulty with concentration, difficulty getting asleep or sleep latency. And then some people even experience GI symptoms, so nausea, vomiting, a tight wrench in your stomach. If you know someone or you yourself experience any of these symptoms, I urge you to please seek some type of professional help. At this time, I think that we've kind of touched on some of the points of, what might lead one to feeling depressed. We also talked about some of the triggers that might lead one to feeling anxious. And we talked about some of the signs and symptoms that one can use to identify a major depressive episode or a generalized anxiety episode. And so I'd like to give the audience a chance to uh, or open the floor per se for questions. Is there anything that the audience or that you guys would like to know, specifically college students, about coping with anxiety or coping with depression, and being able to deal with this COVID crisis or the pandemic that we're currently in? Not all at once, guys. All right, so we have a question from one of our listeners saying that they're having a hard time keeping up with work online. They say that it feels meaningless to do this work now. Is this a sign of depression? And so depression and anxiety, like I said before, is multifaceted. And so and symptoms. So lack of motivation or self-esteem, how we feel about oneself is definitely an indicator of depression. But also with this change in environment and the transition to us being at home now, we have to be able to separate the two of them. And this is where having a mental health practitioner, or having somebody on board, a therapist, somebody that you can talk to about coping and dealing with these skill sets, is key. Because if we are dealing with these issues of focus at home, it might just be that we now have different distractors. We have different things around us that are stopping us from wanting to contribute to our classwork and to our activity. So not necessarily, I wouldn't say that that within itself would be enough to diagnose a depressive episode, but it is one of the factors that might play into depression. If there were other things or a persistent elevated depressed mood for a period of 2 weeks plus a lack of motivation, not wanting to get up, then I'd say we're probably leading more down the lines of depression. Another listener is asking a question. They said, "Hey, Carrie, many of my classmates and I have a hard time with productivity and finding that we prefer to sleep. Any tips on how to get out of this rut?" That's a great question. Right before I started this online session, I had a patient of mine come in, and she was having a similar problem. So she's having to work from home, like many people are currently. And so the way that I tell people to tackle the productivity issues is to create a schedule. So when we have a schedule, a task list, a vision board per se, we can kind of put ourselves on a regimen, and depending on our personality types, if we are people that are very motivated, very driven, and we can reward ourselves per se for completing our tasks and our schedules, then I would say that that is something that you could utilize to help. But what I tell them to do is create the schedule and mark things off as they go by. This allows us to see, it's like building a house. If you have a foundation, you start to block up next, and then you start to put the insulation in, you start to put the roof on. As you go piece by piece and you see the progress that you make, it motivates you to continue to build a home. It motivates you to continue going on. And so if you can cross off areas of your schedule, then you can kind of see some of the progress that you're making, and it kind of motivates you. Everybody loves sleep, but too much sleep or too much of anything in excess can be a bad thing. And so getting sleep, but also taking breaks from being productive is good as well. And so breaks in productivity, we should engage in something meaningful, something that's informative, something that's stimulating. So not trying to do too much at once, especially major tasks. I tell people to break tasks up into categories per se, and as they continue to contribute to those tasks, um, and they start to see some type of involvement in the task, then that would be a strategy that I would use. The same listener asks, what coping mechanisms would you recommend for people who feel as if this will never end? So I've urged a lot of people to pick up new hobbies, new skill sets, because we don't know the latency period of the pandemic. We don't know how long this will last. And so being able to have something to look forward to, a new skill, some new type of task that you can become involved in or entrenched in, something to kind of shift your focus and distract you from some of the white noise and some of the satire that's out there about the pandemic crisis is definitely one of the coping mechanisms that I use. I've started to do a lot of relaxation techniques and mindfulness, stretching my body out, deep breathing exercises, so breathing into boxes. And one of my former mentors and instructors, Dr. Tapa, he always told us to lie down, relax, close our eyes, and breathe through different areas of our bodies. And to me, that was ludicrous. I was like, how do you breathe through different areas of your body? But apparently, if you're breathing from your chest or your stomach, you can guide air into different aspects, different parts of your bodies. And being able to do this while completely clearing your mind, has been a really, really good coping mechanism and coping tool for me. I've also used this time to catch up with old friends, people that I haven't communicated with in a while, just to let them know, hey, I haven't forgotten about you. I've been busy. I've been thinking about you. And so I've made a lot of men's and a lot of relationships that might have been lost, had we not made a reconnect. And so I've been finding meaningful ways to help with coping strategies, and knowing that this too, just like everything else, will pass eventually. We have about 2 or 3 more minutes for questions. If anybody else has any questions that they'd like to ask. Currently, we're discussing coping with anxiety, depression as a college student. So one of our listeners says that my stepdaughter is in college and is having a hard time knowing how to plan for the summer. She wants to get a summer job, but doesn't know when she can return to her college. She wants to make a plan. And so that's a good question. Everything is up in the air. We really don't know, and so long-term decisions currently is something that's really, really hard to do. What I would tell your stepdaughter is that, being forthright and being honest about, about her situation to a potential employer is definitely the best course of action. And so in the get-go and letting them know, hey, I'm a college student, I'm interested in getting a job, I'm interested in employment. But if school starts back up, if school opens back up, then I want you to know that school is my priority. And that's what I'm going to do. And I've seen a lot of college employers. I've even had it in my own experience where people give people chances. And so a lot of people like to see young people doing a positive thing, doing positive things in their life. And so somebody might be willing to take her on with the added knowledge that she is a student first and foremost, but is also interested in gainful employment. Another thing that I'd like to just add briefly is that uh, creating a schedule per se, we don't have to be hard fast on a schedule, but at least having some lineup, some type of regimen, still getting up in the morning, brushing our teeth, having our breakfast, even if we don't leave the home, doing home exercise and home workouts to improve our overall well-being has proven to be effective strategies to decrease depression and anxiety, as opposed to laying in the bed, possibly watching a show all day, or not, or self-isolating per se is what it's doing. Different tools like Zoom and stuff have been very, very key in helping people stay in contact and stay in touch. For myself, I've been using WhatsApp to talk with family members in the Bahamas, with my fraternity brothers back in Arkansas and different parts of the country. So the internet can be a great thing, great device, depending on how we use it at our disposal. I think we have time for one more question if anybody had one more question. Okay, well, without further ado, if we don't have any more questions, we'll bring this live stream to an end. I thank you guys for tuning in, and I look forward to seeing you guys. Wait, 1 minute, let's see. Do you have recommendations for students who feel isolated? Okay, I'll go ahead and answer this question before we end. My recommendation for students who feel isolated is knowing that you aren't alone in this feeling. My patient population has increased drastically and significantly, especially since the pandemic crisis has came about. I've incorporated telemedicine, but I'm here still in the office seeing patients. Um, the biggest recommendation that I have for students are knowing that that getting out, being able to get out, get in nature and do stuff sometimes, whether this is around the home, is productive. Being able to communicate and talk with friends, find out what they've been doing during their isolation, and being able to find activities, things to help stimulate oneself, is also very, very productive. The feeling of being self-isolated or isolated is transient, it's temporary. And the minute this here resolves, I think a lot of us will kind of, want to have some more alone time because we've grown an appreciation for a lot of us have. But the recommendation for students who feel isolated would be similarly to do things to help stimulate themselves, things to sharpen their skills, and working towards productive tasks like building resumes, like we talked about earlier, or planning futuristically for a job for the next semester, or planning, maybe career goals, like what are their aspirations, drawing out a short-term 5-year plan or a long-term 10 to 15-year plan, things that they hope to get accomplished. That's a task within itself, and that's something that can be used to help utilize some of this time where people may be in isolation. Some of our best ideas and thoughts come to us when there isn't a lot of background and outside noise. And so I think taking advantage of this quiet period and the period of being isolated is something that we have to look at from a perspective of positive view and of optimism, knowing that it won't last forever, but while it exists right now, we have to take advantage of it. Well, guys, I think we're all out of time. I really, really appreciate you guys listening into the session. And I'll be speaking with our marketing team in the future about doing other videos for other topics. Once again, the link for our telehealth service is in the description. And so you guys can go ahead and tune in. And if you do know somebody or need somebody in the North Carolina area that has similar issues, or has some issues with depression and anxiety, you can forward them that link, and they'll be able to schedule a session with one of our professional psychiatric providers. Thank you, guys. I appreciate you.